Welcome everyone to the Canadian Diabetes Association's 2016 webinar series. My name is Farah Ismail and I'm a program manager for the CDA, and I will be your host for today. We are delighted that you're able to join us for our webinar on kids with diabetes and understanding their right in schools. To start us off, I'd like to draw your attention to our survey. It's located at the top right-hand section of your screen. In order to better serve your needs, we kindly ask that you provide us with your input by completing a short survey towards the end of the presentation, and we thank you in advance for your input. Now, throughout the presentation, you will have the opportunity to ask questions. So this can be done by typing in the question and answer box, and that's located towards the bottom right-hand section of your screen. And our speaker, Michelle, will be happy to answer questions at the end of the presentation. As well, we will be displaying a few polling questions at the beginning of our presentation and would love for your participation. And I do want to note that all responses will remain completely anonymous. Also note that you are able to customize your screen so you can expand and collapse them as you see fit. And this can be done by simply dragging down the bottom right-hand corner of each of the webinar pods. Our presentation today will be about 40 minutes in length, and we'll have another 10 minutes at the end for questions. I do want to let everyone know that our presentation will be recorded and made available on our Canadian Diabetes Association website within the coming weeks. So now I'd like to get us started on our first polling question. So if you guys can let us know, how are you affected by diabetes? And select the option or any of the options that relate to you. And I'll give you 1 or 2 seconds to get that answered. Okay, so let's take a look at our results here. Okay, so we have a small portion of the population or our participants today that have type 1, a really large population, so about 76% of you are a parent or family member of someone with diabetes, so welcome. 31% are healthcare professionals, and we do have another small portion of participants that fit into a different category. So thanks all for coming today. If you are a parent of a child with diabetes, how old are they? Are they in preschool or younger, elementary school, high school or older, or is this question not applicable? Let us know and we can see the results. Okay, well, it looks like the majority of your kids fall within elementary school ages. There is, again, 7% of you that are in preschool or younger, another 1/5 of you that are in high school, and again, 10% not applicable. So thanks for answering that. We just have 2 more polling questions before we get into our presentation. So for those of you who are healthcare professional, please select the option that best describes you. And so here in this question, you can select more than one option. So please select all the options that apply. And I'll just give you another second there to respond to that. Okay, so again, welcome pharmacists. We have some RNs, some RDs, some certified diabetes educators, another portion that fits into other categories, and then again, a portion of you that is not applicable. So thank you for responding to that. And our final question is really to help us understand how we're participating today. Are you participating as an individual, in a group of 2, a group of 3 to 4, or in a group of 5 or more? And let's see the responses to that. Okay, great. So it looks like a majority of you are participating as an individual, some of you in a group of 2, and some of you in a larger group of 3 to 4. So that's great to see. Once again, welcome everyone, and thanks for joining us today. So now I'd like to welcome our speaker, Michelle Warren, and thank her for joining us today. But again, before I turn it over to Michelle, I'd like to give you a brief introduction. Over the last 11 years, Michelle Warren has worked at the St. Joseph's Healthcare as a community support worker for an outpatient psychiatric team where she's serving clients experiencing severe and persistent mental illness. Prior to this, Michelle worked in community mental health in other capacities. Michelle has also completed a program on diabetes education, so to learn more about type 1 and type 2 diabetes. She also teaches part-time at Mohawk College. So for more information on Michelle, please read the speaker bio section, and that's located on the left of your screen. So without further ado, I present to you Michelle Warren.
Hi there, everybody. Thank you for joining me this evening to talk about guidelines for care of students living with diabetes in school. I am a mother of a type 1 child, and my passion to learn more about type 1 was part of the reason I was getting involved in working in this area and doing different things. So tonight, my objective is just to review our story and on our experience within the system to enhance the health, safety, and emotional well-being of our children in school experiencing type 1 and providing guidance regarding students and diabetes management. To promote positive, caring, and inclusive learning environment through enhanced communication, education, and cooperation between all members. The CDA objectives for tonight are to learn how to effectively communicate with school personnel about a child's diabetes, including their individual care plan, identify ways to educate school personnel about diabetes, hypoglycemia, and managing emergencies, understand the role school personnel plays in blood glucose monitoring and medication administration, learn how to help your child avoid severe hypoglycemia at school, to understand the roles and responsibilities that parents, caregivers, and school personnel and healthcare providers have, and to be familiar with the CDA guidelines for care of students living with diabetes at school. So a little bit about our experience. Ty was diagnosed at age 3. He was drinking a lot of water, using the bathroom a lot. We weren't too sure what was happening, so we went to our family physician, where immediately he was tested and sent to McMaster Hospital via ambulance because his blood sugars were too high. So from there at McMaster, he was treated with excellent care, and for the weeks coming from that, we were able to learn and work side by side with the nurses and child life specialists as well as the social worker. Ty was diagnosed in February, and that coming September, he was to be enrolled in JK at our school in Grimsby. Our experience from there, obviously being a very nervous mom, not knowing anything about diabetes and nothing about type 1, I had to take a lot of information, do a lot of learning for myself. I went to different schools in our area just to kind of feel out the resources and how the personnel was and the principal. We found a fit for Ty that we thought would be best. The principal was quite open. He was scared because it would be his first child with diabetes, but he was willing and obviously able to try to take on that challenge. So with that, in meeting with our school and the healthcare team that we have, we asked that we have a nurse help Ty through the school day. So we did get approval for nursing through CCAC, and community nursing came out and helped us with Ty for 3 visits a day while doing and getting used to the school. We've been lucky enough to have nursing continue, and Ty's now in grade 3. So we've advocated every year after to have Ty have the nursing care show up. So that's been a bonus. It has been hard. We've had to juggle and push some days and educate a lot of the staff at the school, but it's been a perfect last few years with Our Lady of Fatima. So blood sugars can change from hour to hour, so it is very important that school personnel are educated and equipped to support students with diabetes. Staff involvement is essential to help the student optimize their school performance. Children and youth spend about 30 hours a week in school, and it's important to ensuring that students with diabetes are safe and well managed. Often parents are frightened and scared when their students or their child is going into school, and they're not too sure how the care will be on the other end. So it's really nice if when you do get school staff that are willing and able to learn about type 1. School personnel, it's known, that school personnel may be the first to notice signs of undiagnosed diabetes in children as well. So they'll see like more urination or excessive thirst, and in some cases weight loss. Support for students with diabetes is inconsistent across Canada, and therefore the discrepancies in resources and policies across the country, even among schools in the same jurisdiction. So within our region, there's schools that follow completely different guides. We're trying to work together to have resources within each other to make it a little smoother for students that are diagnosed in our area. So under the Charter of Rights and Freedoms, every citizen, including, I'll move ahead here. Under the Canadian Charter of Rights and Freedoms, every citizen, including people with disabilities, have the right to equal protection and benefit without discrimination. In March 2010, Canada's Parliament approved the United Nations Convention of Rights of Persons with Disabilities. All the provinces and territories are now bound by the agreement, which among other rights ensures that effective individualized support measures are provided in environments that maximize academic and social development consistent with the goal of full inclusion. Legally, schools must reasonably accommodate the special needs of children, including students with disabilities. Schools also have minimized barriers to prevent children from the fullest possible learning experience. The CDA can help you with that have developed the guidelines for care for students with diabetes. And through these guidelines, it can help you process your child's care plan by learning and following the steps within the guide. Sadly, in most jurisdictions, these recommendations from the guide have not been incorporated into policy. The level of support that a child or youth receives depends on where they live, the school they attend, and often their family's advocacy efforts. Children with diabetes may also be refused entry into daycare or after-school programs. So in our experience, Ty, we needed a daycare or after-school program, and Ty was, declined or refused to be taken care of at the YMCA program, the after-school program. So we did try to fight that for, quite some time and trying to work with them, but unfortunately, it just got to be more of a headache. So we did end up finding a more suitable home daycare for Ty for after school. So managing diabetes at school, support for students with type 1 diabetes should be individualized, and best practices, principles will help foster individual dignity, personal independence, and diabetes self-management appropriate to a student's age and stage of development. When a student has diabetes, it is important that the school be informed at 2 levels. They need to be educated on type 1 and understand risks involved, and they need an individual care plan specific to the child's needs, and it is important to ensure consistency with the education provided at the school. So for communication and education, I would always meet with healthcare providers on a regular basis to develop and review the student's care plan and to ensure daily management and emergency plans as indicated. We typically arrange a meeting with the school principal to review Ty's student care plan and to ensure the plan is current. It is ideal that the principal must meet with the students and parents to discuss the student's daily diabetes management requirements at the school. The principal must ensure that student's care plan is shared with and made available to all school personnel that is in contact with the student on a regular basis. We also have, within our school, we have also shared the information with the substitute teachers, the resource teacher, obviously, anybody that comes in contact, so the lunch lady, the recess guide, anybody that will see and know Ty. So further to communication and education, you should establish a formal communication system with the school personnel who come into contact with your child. This should include an appointing at least one staff member to be a point of contact for the student and parent. In our case, we have our teacher, Ty's main school teacher, so he's in grade 3, so she's been willing to jump on board and be the main contact as well as the resource teacher at our school. It is very important to identify the student with diabetes at all school personnel including volunteers, substitute teachers, student teachers, and support staff. With permission of parents, you may choose to display identifying information in the school staff room and within the school, and have an emergency information folder made available to them. Of course, these folders should also include specific information to the student. Placing medical alert stickers on the student's file is also identifying. There are potential barriers to prevent hypoglycemia in schools, which is incomplete training of school personnel, unscheduled activity or inactivity, altered meal or snack times, and lack of rapid access to glucose meter and emergency and treatment supplies. For day-to-day care, students with diabetes does not always require a medical professional at school. Diabetes education teams teach and empower patients, families, and caregivers to monitor blood sugar, give insulin by injection or pump, and recognize and treat hypoglycemia and supervise snacks and meals. Intensive understanding is required to fully manage diabetes as a parent or caregiver, and this level of care is not to be expected within the school. When providing basic care to ensure safety and to perform standard diabetes management tasks while children are in school is rightfully expected and should be provided by trained school personnel. School employees should be aware that they will not be found liable if they take reasonable steps to assist a student with diabetes in an emergency situation. So often that is a lot of the discussion amongst parents. If a teacher will help the student and not know everything, everyone thinks that there's going to be like this big liability, and they don't want to be responsible for that. So we've given all of the staff within the school, the understanding that just help our son whenever needed, and it's a good kind of policy to run. Hopefully, most of the teachers would do that. So communication and education for healthcare providers. Your healthcare team, CDA, can provide posters identifying symptoms of hypoglycemia and hyperglycemia for posting. Ideally, it would be beneficial for them to be a resource to the school to provide or arrange diabetes education and training. In many cases, with the increase of type 1 in schools, CDA has assisted in presenting to most of the schools in our region that we know of. We have used our child life specialist. We've had CDA and juvenile diabetes come out, and they have worked with Ty in each of his classroom settings. We've also done large presentations for a full grade, so all the grade 3 classes or whatever particular grade Ty was in, there would be a larger presentation to the school as a whole. So for the individual care plan, the student's care plan provides very specific information and provides school personnel regarding your child's daily diabetes management and diabetes emergency plans. A plan should include identify students with diabetes and diabetes management, example, insulin injections and pump, frequency of blood sugar monitoring, and target range. This was an example of someone's individual care plan that was shared amongst us in order to try to use that for our plan. So we did adopt some of this into our plan in a different fashion, but this was a guide that they had given us. So Ty-specific individual care plan, there's resources located at the bottom of your screen, and you can feel free to upload those and just use it as a resource if you like. as well at the bottom of our screen, the same for the nurses plan. So just please refer down to that portion down there. And that plan was reviewed by CCAC, Community Nursing, and our family to provide a step-by-step guide for the student and the nursing visits. I provided a picture of our logbook. I hope it's clear on your end. So in our logbook, we will, whatever is located in Ty's lunch bag, we will list in this notebook, and we'll put a carb count beside it. The nurse will come in during AM snack, lunch, and PM snack. So she'll do her 3 visits at a half hour each, or probably within 20 to a half hour each. The AM snack, she'll write under there, she'll usually identify what Ty has eaten and add the carb count up and let us know. And then she usually balances out whatever's in the lunch bag as well. So, your protein and snacks and goodies and fruits. So she does her best at doing that. And she'll leave us his blood sugar number each visit. As well, sorry, this is another plan that my husband and I have done. So because we both work in the healthcare field and we're both really busy on our jobs, my husband will do like 2 on-call days. So we'll put his number on the top of the log sheet, and that indicates to the nurse that they're to call him for that day. And then I'll have 2 days that week, and they can call me. Of course, they can call both of us at any given time, but that's kind of our on-call person. And that's to help us so that we don't get burnt out, because we were getting really burnt out at the beginning when Ty was first diagnosed. So the individual care plan continued here is the student care plan should define causes, prevention, identification, and treatment of hyperglycemia as it pertains to the individual child. Snacks as well as ongoing supply of fast-acting glucose for treating hyperglycemia should be available at all times for the student. And school personnel need to understand that the symptom of hypoglycemia affects behaviors and students' ability to perform school-related and other tasks. So type 1 in hyperglycemia, everybody likely knows this. So it can be a result of too much insulin, delayed or missed meals or snacks, and or physical activity than usual without corresponding increase in food or reduction in insulin. The student should immediately be given fast-acting glucose according to the student's care plan. It is imperative that hypoglycemia is treated immediately as indicated in the student's care plan. And there is a list of roles and responsibilities listed in the care plan. And to ensure student is not left alone following the treatment of a hypo until blood sugar levels has increased and stabilized, and ensure adequate time to treat hypoglycemia prior to participating in any school activities. And in our care, we've always asked that they notify the parents if he's gone too low and treatment's been provided. We found this resource quite helpful for the staff to identify some of the things that Ty may be feeling during the school day when he is low. Oftentimes, Ty will say his tummy hurts or his tummy feels weird, and that's another indicator as well. He sometimes gets a little tired and will twirl his hair when he's not feeling quite himself. So for severe hypoglycemia, it is important that staff understand how to respond quickly. Severe hypoglycemia is an emergency situation and often requires the administration of glucagon. School personnel should be trained to administer glucagon if there is a mutual agreement with parents and training has been provided. School personnel to call 911 immediately and notify parents. In this area, we've often found that it's very controversial with schools and parents, as it is a life-threatening incident. So at our school, our principal has taken it upon himself to just direct the staff to call 911, obviously call the parents. Ty does carry glucagon in his backpack regardless, But the principal, again, went ahead and he went in and did these particular measurements and was just checking the response time of an ambulance. And he did these little safety things, I guess, on his end just to feel better, which was fine. To date, Ty has not had any of these problems at school. So hyperglycemia. Students in these cases should always be directed to check ketones in urine. Some students have access to a ketone meter and always contact the parents. School personnel should always provide opportunities for the students to deal with symptoms as necessary, including access to the washroom or drink water more frequently. Allow additional blood sugar checking as well as ketone monitoring. Parents instruct to administer insulin or correct via pump. And schools should always understand hyperglycemia can affect behaviors and the student's ability to perform school-related activities as well. So another one of our resources that we used at our school just to identify some of the symptoms for hyperglycemia. So severe hyperglycemia, untreated hyperglycemia may lead to an emergency situation, which is DKA. Parents should be called if a student is nauseous, vomits, or shows any signs of illness. In these cases, follow the emergency plan. The school should be notifying parents and calling 911 if student is vomiting and take action according to the student's care plan. Daily management. School personnel can only perform blood sugar monitoring if there is a mutual agreement with the parent as indicated in the student's care plan and if training is provided and staff are comfortable taking on the additional role. Often you hear teachers do not want the responsibility. In our case, through support and education, teachers have come on board and wanted to learn and assist with Ty. We've also had our physician sign for nursing, so she'll do the CCAC referral, and we've had to advocate through that. So a CCA referral can be made by your doctor, and you can be assigned to community nursing. It doesn't usually go as smoothly sometimes, although the doctor may sign a form stating that you could use the community nurse. Sometimes CCAC will still have you advocate why you need that nurse, even though it's been signed for. So it's often in your presentation. You may be frustrated and frazzled as you know your child needs support in school. However, presenting this way makes it harder for the healthcare provider to understand. Therefore, be calm in presenting your case. Your presentation is required for them to get an adequate funding to help your child in school. So nutrition, the balance of food, medication, activity is essential to achieving optimal blood sugar control. Timing and quantity of food is based on the individual student's care plan. So missing a meal or snack or eating less than planned may result in hypoglycemia. Eating more than planned may result in hyperglycemia. With planning, a student with diabetes can enjoy all the same foods as everyone else, unless indicated in the student's care plan, and there are no forbidden foods. Parents should inform the school of student meal planning, including time, type and quantity of food, and include this information in the care plan. You can also obviously let them know of any food restrictions, such as celiac or food allergies, and ensure that all meals and snacks are eaten completely and on time. A nurse in many cases, or in our case, does help Ty in the early stages. He eats well now during lunch, but in the early grade 1, grade 2, she had to push him to have his lunch. So sufficient time should always be provided for the student to finish his snacks and meals, and younger students should be provided with supervision or a community nurse to help. So physical activity. In cases of unplanned activity at school, eating an extra snack may be necessary. Exercise, sports, and extracurricular activities are 3 of the main factors which may affect an individual's blood sugar levels. If activities are found to affect blood sugar levels in predicted manner, then the request of a parent, and according to the care plan, insulin administration may differ from a usual regimen during certain specific activities. Schools typically note on their calendars when there's going to be an event or an activity, and it's a good time to plan ahead of time with the teacher around that. And education to recognize that there is often a higher chance of hypoglycemia in the hours following intense physical activity and other intense activities, to be alerted of any signs of hypo in the student. So I think that's a lot more education that you should be providing for when your child's in older grades and they're participating in a basketball team or a track and field. Those type of activities as well need to be monitored, and the coach has to be on board. So with that, I'm just going to finish up and show a couple pictures of Ty. This was one of his first events from grade 1. We did have Chris Jarvis come out. I don't know that you can see him in the picture, but we did have Chris Jarvis come out, and he did a full presentation to the entire school about type 1. They were able to change and wear blue shirts, and we did the symbol for diabetes from the rooftop. They took the picture. So that was a great event for everyone, and a lot of the students know Ty from this. Another event here was when Ty was in, I think this was grade 2, we did an event. Sorry, this is grade 1. Ty, we gathered all the grade 1s together. We had the child life specialist attend from our hospital, and we had the principal and all the teachers involved and all of the grade 1s, and we painted our hands blue and made handprints around the school just to identify type 1. Sorry, and all these events have been on or around November 14th to support Diabetes Day. And another opportunity Ty took was they made some bracelets at the school, rubber, I think they were the rubber bracelets, and they went around and a bunch of kids sold them on his behalf, and they went around and did that and collected money, and Ty asked if he can give back to the clinic that helped him most when he was first diagnosed, and he wanted to help those kids and by doing a little fundraiser and purchasing them little prizes, because there's like a little care box there for children that are struggling in their first few weeks of diagnosis. So he wanted to give them little treats as well. And here is the reference and acknowledgements. So I just like to recognize that a lot of the information was from our guidelines of care for students living with diabetes at school, as well the paper from the Canadian Pediatric Society, Children with Diabetes, as well as JDRF. The signs and symptoms photo there is also a resource that we had used for education within the school. So I will finish up here, and if there's any questions.
Great, thank you so much, Michelle. It's an amazing webinar. We've gotten some really great feedback from participants, and they're really grateful for not only you sharing information in terms of care management and care plans, but really just sharing your experience and your personal story has really added a lot of value. So thank you very much for that. So yeah, just as you said, we will move on to our question period at the moment. So I'll start off with our first question. One of our participants has asked, our school and the YMCA aftercare do not have any logbooks. Should we encourage them to have one?
So we have brought, we incorporated the logbook to our school. So I've prepared the kit for Ty, so everything is in a kit, and as well as the logbook we're writing. So we find it very helpful. It's an excellent communication log, whether you're talking back and forth to the school throughout the day, or if it's just written in the log, you know kind of exactly what's going on. So we find it helpful as our family and it's an amazing resource for us to go back and say what happened this day, or did Ty not bolus or something. So yes, we do find it very helpful, and I think that you should provide the logbook to them.
Great, thank you for that, Michelle. Our next participant has said that I'm 14 years old. What if I miss a meal and my sugar drops and am not allowed to get anything sweet? What do I do?
I would try to find something to eat. I think it's crucial to your health that you take care of yourself and have those extra things available to you if you miss a meal. So always carry some type of pack with you. If it's obviously your Dex tabs, some granola bars, anything that you can have to keep yourself feeling okay.
Great, thanks for that. Our next participant has asked, what blood glucose level is considered to be hyperglycemic?
Hyperglycemia is, for us, it's obviously when there's ketones showing. So we've been taught anything with a ketone, so it could range. Ty has shown ketones at 19, and other times at 24. That doesn't happen as often. He has shown no ketones, so that would be hyperglycemia. Anything above the range in the CDA, I would say, the guidelines.
Great, thanks for that clarification. Our next participant is asking for suggestions in terms of what type of supervision or help for a child heading to middle school, grade 6, where they move from class to class and see different teachers all day. Is a child pretty much on their own for care in this kind of a situation to just look out for their own lows?
I think by grade 6, you've given your child a lot of skills to carry forward with him as he's entering into the grade 6. I still believe that education is essential to your child in school. So I think he may be seeing different teachers, but they still have a requirement to understand and know that the student, your child, has type 1, and to be aware of that in class. So although your child should be able to carry his pack and everything with him, I still do believe that in our case, I would educate all the staff that are going to be working with them, teachers, throughout each class.
Great, thanks for that, Michelle. Our next participant has said, how do you deal with schools that want to be very hands-off with type 1 diabetes management? Any suggestions or recommendations?
So that's a hard one. So I don't know that I haven't experienced a school that hasn't. I mean, I've had teachers that are scared to work with Ty, but with education, I think as long as they feel comfortable and they understand and they have the ability to communicate with you at any given time so that they understand. I always explain that there's no question that's stupid, so ask away. I give them resources. So I can't speak to a school that hasn't wanted to take on not wanting to do anything with the student. I think that student has the right. The school has to understand type 1, and I think it's just a lot of advocacy and education in pushing and letting them know that there's your son or child will not be the first one coming to their school with type 1, so they might as well learn.
Great, thanks for that, Michelle. Our next participant is asked, how do you handle school field trips? Do you go along with your son?
In the first few years, yes, one of us would take the time off because the nurse was not able to go on the field trip with them. In many cases, the teacher did take care of Ty, once they got used to his schedule and food and how he responded to low blood sugars. So Ty now is able to attend field trips, and the teacher is his support throughout the field trip.
Great. Thanks for, again, sharing your experiences, Michelle. It's really great to be able to have you as a resource. Quite a few of our participants have some questions around administering glucagon and whether that should be done versus calling 911. And one of our participants has even asked, wouldn't all schools be obligated to administer glucagon?
Yes, you would think that. I think that because the way the glucagon is set up and it's not used very often, so it is a learning. It is a big learning stretch for them. It's still learning for me. I can't remember the last time I used glucagon in the 5 years with Ty. So I guess in discussions, there's chances that it could expire if you're not kept up to date with it. And our school, again, has just thought that the response time for call 911 is just as quick, well, maybe not just as quick, but within minutes they're at the school, and Ty will have his glucagon with him in his backpack. I wish I could have them participate and schools participate, but that's something that I think is still being pushed within the schools.
Okay, great. Thanks for that. Our next participant has asked, what advice would you give to someone who takes insulin and is still seeing episodes of high blood sugars?
Oh, I would refer them back to the clinic and let them review their log, and just maybe look at their ratios, carb ratios, and whatnot. But I definitely have them speak to their nurse directly and their dietitian.
Great, thank you for that. Our next participant has said, how are students supported in your schools who do not qualify for nursing visits?
So we have another student in our school currently that actually stopped his nursing. He did have nursing, and he does his own insulin on his own, and he and his family have worked a plan out where he has a cell phone, or I don't know if it's a cell phone or device, where he texts back and forth to his mother, and he gives himself his own injections. And I believe he's in grade 5 or 6, so not far from Ty, but that was something that he wanted to do. He felt that the nursing care was more troublesome to him and more interruptive to his day than, and he wanted to do it on his own. So I think it's up to the parent. Yes, a lot of schools or a lot of times students with diabetes do not have nurse, and I think a lot of times it's giving the student and the teachers the guidance to help the student through the day. Another student in our area, the mother actually goes in. She is a stay-at-home mom, and she has chosen to go in to give her child a check-in at lunch. So I think there's different avenues you can take in order to keep your child safe at school.
Great, thanks for that, Michelle. But this one's a bit of a piggyback to the response that you just provided. Our participant has asked, how do you feel about older T1D kids having a smartphone at school to communicate with their parents regarding their BGs?
Having a, what was that?
A smartphone, sorry.
Smartphone, yeah, absolutely. I think it's a great resource to have these devices nowadays that can communicate back and forth to parents via text. I think it's not as disruptive to keep running to the office to call. So I think it's an amazing little way to communicate with parents, and it's a safety, something to keep them safe.
And our next participant has asked, in your opinion, is it okay for kids to measure his or her blood sugars in the classroom?
Absolutely. I think it's so important that your child is able to do his blood sugar in school in the classroom, because his peers are the ones that are beside him all the time, and they need to understand what he's going through, what the child's going through. So in a lot of cases in our school, we do have a buddy system, and they'll learn a little bit more about Ty, and Ty feels comfortable giving a blood sugar, and no one looks at Ty anymore in class. It's just like a regular routine like anything else, and they go on about their day. Initially at the beginning of the year, I think a couple of the newer students that weren't familiar with Ty would look over and wonder what he was doing. They asked Ty questions, and he was very open and shared what he was doing. And it became more of a family type classroom. So they watch out for, not only Ty, but they watch out for each other. And I think it's great to have that kind of peer support. Previous year or two ago, the one student that I was speaking to actually was having his lunch, and he was isolated. They had him eating his lunch in the office, and it was so frustrating for me to come into the school and see that, Ty was receiving care from a nurse, and another student had to sit in the office to have his lunch. And so there was a lot of education around that in having that student return back to, a daily routine with the rest of the students.
That's great. Thank you so much for sharing that, Michelle. We'll just take one more question here before we close off our questions. But I do want to remind everyone that for the questions we did not get to, please email us at webinars@diabetes.ca, and our CDA staff will be happy to respond. So with that being said, our last question is, do you have any suggestions around school tests and high blood sugar?
I have not had that occur. Ty is still in grade 3. I spoke to our endocrinologist about it at one point, just asking what happens with their blood sugar when we are hitting exam time. And by our endocrinologist, it was just referenced we should prepare for that. I know you can't always prepare when your sugars are going to change, but there was no different kind of routine. But if you're definitely not feeling well, let the school personnel know. And I think that you can direct your own plan from there with support of your healthcare team.
Great. Thank you so much, Michelle. So folks, that does conclude our webinar for today. I'd sincerely like to thank Michelle on speaking on behalf of the Canadian Diabetes Association. It's been a great learning experience, and we definitely appreciate you sharing your personal experience with us. Just a reminder, our webinar will be available online in the coming weeks, so please check Michelle out again if you've missed any information. Again, Michelle has referenced some of the resources. She's spoken to a few today, and so if you'd like to download them, you can download them right off the webinar, and that is located at the bottom section under the resource section of the webinar platform. Our upcoming webinars, next week we're going to be having one on type 1 diabetes and transitioning into adulthood. The following week on May the 25th, we'll be talking about diabetes burnout. And again, to close off our series on June 1st, we'll be discussing diabetes technology and devices. So please join us for those. We look forward to your participation. So for those of you who know, the Canadian Diabetes Association has a diabetes charter. The vision of our charter is to have a country where people with diabetes live to their full health potential. So be part of the catalyst for change and sign the charter. So to find more information or sign the charter, visit diabetes.ca/charter. And for those of you who are unaware, actually, our CDA offers many camps for youth living with diabetes. So our 12 summer camps and 11 family camp programs help children, youth, and families get the support they need to move on into surviving a diagnosis to thriving in spite of it. So if you'd like more information on our DCamps, please visit our CDA website, and you can register at dcamps.ca. For those of you living in the Regina region, we actually have a CDA Expo that's coming up this weekend, so Saturday, May the 14th. It's a free event for all people living with diabetes, so be sure to check that out. You can find out more details at diabetes.ca/expo. And for any other questions that you might have, please visit either our website at diabetes.ca or call our 1-800 number. So that's 1-800-226-8464. Thank you again for your participation, and we look forward to seeing you next week.